The American College Health Association 2014 reported that college students were faced with mental health problems within the previous 12 months. 21.9% affected by anxiety, 13.8% affected by depression, 30% affected by stress, and 20% affected by sleep difficulties. Due to this, college students' academic performance is being affected. That being said, many eventually look towards the field of psychiatry to receive the help they truly need.
What is psychiatry? Well, for starters, Emil Kraepelin was considered the father of psychiatry. He proposed two categorizations of mental illness, the first being endogenous disorders and the second being exogenous. Endogenous disorders consisted of factors that were caused internally, while exogenous disorders were caused by external factors and were typically more treatable. For example, if an individual was depressed, it could either be caused by genetic factors, endogenous, or a reaction to a particular situation, exogenous. Although it may seem straightforward, many are still unsure of the job description of psychiatry. Therefore, according to American Psychiatry Association, psychiatry is a branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders.
Amy is a licensed clinical psychologist and has spent the majority of her career working in the University Counseling Center. She will quickly discuss the difference between psychologists and psychiatrists.
So one of the primary differences between what a psychologist does and a psychiatrist does is our training is very different. So a psychiatrist is actually a medical doctor who goes through medical school, who is then trained specifically within the specialty area of prescribing medication for those with mental health concerns. Different from myself as a clinical psychologist, I went through just graduate training where I learned about how to do proper therapy techniques, research, all of that around treating from a therapeutic perspective individuals with mental illness. So psychiatrist as a medical doctor, as I said, is able to prescribe medication and then treat from a medical model mental health concerns.
Seeing a psychiatrist is ideal for someone who is unable to benefit from therapy alone. Psychiatrists and psychologists often collaborate to create a treatment plan that is best for the patient. This usually includes incorporating a medication which the psychiatrist can write a prescription for. A few examples of diagnoses that may benefit from medication are post-traumatic stress syndrome, major depressive disorder, schizophrenia, bipolar disorder, and ADHD.
Resources provided by the PGCC include individual brief therapy, group counseling, crisis intervention and follow-up, and referrals to assist students to cope with and adjust to college life and pressures, develop healthy relationships and personal growth, resolve personal problems and life crises that interfere with academic success, deal with problems stemming from life experiences, trauma, and situational stress, and learn new skills to optimize decision-making, problem-solving, communication, managing stress, and resolving conflicts.
Students at CSUMB can find mental health support and treatment at the PGCC. You can make an appointment with a psychiatrist who can diagnose and write prescriptions if needed. To schedule an appointment, call the PGCC.